Most of these patients go through anxiety and depression. That is what we see. So when they come to my chamber, they are very sad, they are upset. COVID was one time where we see a surge in the job loss and unemployment because a lot of unwanted changes happen during that time. I am seeing around 30 to 40 patients per month who are impacted by unemployment, job loss, or who are not able to get back to the work again.
What impacts more after layoff? This financial stability or the personal identity?
So the immediate impact is financial.
When this person will understand that he has crossed that line.
Right. Panic attacks like छाती में धड़धड़ होना, घबराहट होना, negative thoughts आना. You know, in India, what we generally do is we don't understand the emotions of the person. When you change your thought pattern, the intensity of the emotion goes down. When somebody loses a job, so what will be emotion like? He will feel sad and disappointed. The job loss has happened. Now you don't have job. That is a reality. How can I face this reality better? Social media comparison on LinkedIn, it makes you feel disappointed more because then you are only seeing the success stories. In last 1 year, there has been a profound increase in unemployment.
Welcome back to the Voices That Impact. Before we start our today's podcast, I request you to please subscribe my channel if you like the content so that I can bring more interesting conversation for all of you. Until last year, you were leading meetings, hitting targets and mentoring teams, and today just staring at mobile waiting for recruiters to reply. Somewhere between, we appreciate your response and we have moved in a different direction. Thousands of people are losing their jobs. And this is not only jobs, they are losing their confidence, their purpose, and their identity. And somehow most of the people are not discussing about the impact that these people have. So we have this conversation today. After layoff, rebuild your self-worth. And in today's podcast, we are going to cover why people feel ashamed after layoff despite the fact that it was beyond their control. When will they get to know that they have crossed the line between temporary disappointment and clinical depression? What are 3 non-negotiable traits that everyone should start accepting, adapting after they lose their job to stay confident and resilient? What is the impact of LinkedIn platform on the mental health for the job seekers? So, for answering all these questions, we have been joined by someone who has years of experience dealing with such people, navigating their career crisis, identity issues, and emotional battles that the person goes through. He is a person, Dr. Mohit Shah, who is a psychiatrist, consultant psychiatrist in Advanced Multinationality Hospital, and he is the founder of Dr. Mohit Shah Resilient Clinic. Thank you so much, Dr. Mohit, for joining us today. Welcome on this show.
Thank you, Shubha. Thank you for inviting me.
So Dr. Mohit, you have met with the people in their most vulnerable days during their job crisis. So if I want to understand before starting anything, just want to understand a little bit about the statistics, that how many of the patients who visit you on monthly basis who are affected by mental health challenges due to unemployment.
Right. As you rightly mentioned, like in last 1 year, there has been a profound increase in unemployment. We all know the impact of artificial intelligence that is happening in the job market. So if you say maybe COVID was one time where we see a surge in the job loss and unemployment because a lot of unwanted changes happened during that time. After that, there was a period where things were stable. Like in COVID, I used to see like 10 to 20 patients a month because of the job loss, because of unemployment. Now there's a rapid rise in last 1 year. I am seeing around 30 to 40 patients per month who are impacted by unemployment, job loss, or who are not able to get back to the work again. So in fact, it's a very, very a big problem, and it is a problem that one needs to understand better. And I think your podcast will really help address these problems.
Yeah, I think and this number is increasing day by day, and because of so many changes which is happening
Yeah,
worldwide,
absolutely.
this is increasing and is a matter of concern,
Absolutely.
right?
You see global crisis, the war, the stress,
The AI.
the AI, the climate change, even
Yes.
climate change do affect a lot of things, a lot of jobs.
Correct. Agree. So, what does phase actually look like when a person who enters into your room for the first time after the layoff? Can you just
Yeah.
explain?
So, see, after the layoff, there are two impacts. One is the financial and the personal. So, of course, when there's a layoff, the person starts worrying about the finances. Most of these people are having EMIs to pay or household to run. So that is the immediate impact. Like, how will my house run? How will be the EMIs be paid? And there is a personal injury also. Am I not good enough? Have I lost job because of my personal incapacity? So most of these patients go through anxiety and depression. That is what we see. So when they come to my chamber, they are very sad, they are upset, they are worried about their future, they are worried about what will happen to their kids, their family, how will they run the household. So there is a lot of worry, anxiety, and depression with which these patients come to me. And when I see them, it is something that you really feel for them, how we can help them better.
Okay, so if I want to ask you, like, what impacts more after layoff, this financial stability or the personal identity, and which of the wounds out of these two is becoming more difficult for the person to heal?
Right. So the immediate impact is financial because that is the immediate impact, and that people adjust. Maybe they cut down their expenses, they readjust their EMIs, sell their properties to kind of handle the situation. So that goes over like some time, but the personal injury that happens because of job loss, because people consider this as failure or something that was under their control. Most of the time it is not under their control, but it's like am I not good enough, am I not fit enough to survive in this environment, I don't have the skills to keep up the job. So, and most of these people are well educated, they are doing well in their life, they've never experienced failures also. So it's a big psychological trauma for them, and that lasts for a long time. In fact, what happens is that if they get a job, like immediately after they lose the job, it is easy to handle it because then they start going with the flow. But once the employment becomes a little chronic, they are not able to get the job, then this leads to depression and anxiety, and which requires clinical treatment.
So, what are those? If I want to understand that, okay, fine, this is now leading to clinical depression.
Yeah, it's a fantastic question.
So, what are those three signs which, or first of all, I just want to know that when this person will understand that he has crossed that line.
Right, absolutely. It's a fantastic question because, see, when you lose a job, the immediate response is disappointment. You are disappointed, right? So you feel little low, you feel sad, and you try and figure out what I do. But if this disappointment, sadness maybe lasts for 1 to 2 months, in addition to that disappointment and sadness, you're also not able to sleep well. You're constantly worried about again getting back to job. You're getting panic attacks like छाती में धड़ धड़ होना, घबराहट होना, negative thoughts आना, बिना कोई टेंशन के रोना आ जाना, thinking about your future. In addition to that, you're not able to eat properly, and even if you know that you need to apply for jobs, you need to crack the interviews, but you're not able to give up your best. You do get that feedback that you're not up to the mark, your confidence is at low. See, if all these symptoms combine, then it is for 1 to 2 months, then it is called as clinical depression. It is no more a disappointment. It is a depression which needs evaluation, which also needs treatment in terms of sometimes medicine and therapy.
Okay. So let's say you mentioned that people are they're not able to continue their job, or they've lost their job. So I just want to ask that what happens to a person like who was once very capable, right, of doing everything, and then suddenly rejection becomes a daily routine for him, application after application, silence after silence. And so how does this impact that person mentally?
Yeah. So see, like suppose I'll give you an example. You have a trauma on the bone. Okay, bone gets a fracture. Now, if that trauma is repeatedly, every day that trauma is repeated on your bone, the fracture will not heal. Similarly, you have a job loss, you are unemployed, you get a trauma, you feel disappointed. Now you're applying again for a job, and again you're getting rejection. So the trauma is trauma is multiplied. Every time you lose a job, or every time you apply for a job, you don't get a call back, or you don't crack an interview. That trauma is repeated, and that leads to chronic anxiety, chronic depression, and that leads to basically the person starts losing hope. Because hope is something that will keep the person driving through, like that somewhere you will crack. But when you lose hope, then the disappointment is a small thing. But when you lose hope, then you don't try robustly applying also. You become like a numb person, and that is a very bad state to have, because then you are losing your identity, you're losing your hope, and then the drive, the energy that is there to sustain or to get a new job becomes less.
So, agar if I want to ask you, kya 3 signs hai? What are those 3 signs, right? Which person now know that now he has to definitely visit a clinic,
Yes.
mental health clinic.
Yeah, so not 3, but see, in psychiatry, how you diagnose a person, there are criterias. Like the 2 versions that we follow are ICD-11, which is by the WHO, World Health Organization, and DSM-5, which is from the American Psychiatric Association.
Okay.
So what are they? Basically, if you have to diagnose depression for a patient, there are 12 to 15 signs, right?
Okay.
That has to be there for 1 to 2 months. I will narrate to 5 to 6 signs. You're not able to get sleep at night. You're getting suicidal thoughts. You're crying, having crying spells daily. You are feeling sad and upset throughout the day. You don't feel like getting up in the morning and going to work, or even doing your daily chores. Like if you don't have work, like, just dropping your son or daughter to a school, or, going and buying vegetables, or maybe just taking off for weekends and enjoy yourself. If these 5 to 6 signs are there for more than 1 to 2 months, then it is called as clinical depression. And for that, you need treatment.
Generally also happens, like it could be a disappointment as well for a person. Like this often happens with someone, like I'm not enjoying my life and I am just doing something without thinking, and as a subconsciously I'm following a daily routine, right? That's
Right.
what generally people often do. And but I'm still like, how do you differentiate now that now you really need, because what you have told, these are the symptoms which I agree, but this person face in a day-to-day life also.
Yes,
right?
they do, but they are more persistent. Like they don't see these symptoms come momentary and go if you're disappointed. But if you're depressed, you day in day out 24/7, the feeling doesn't go. You don't feel the spark of happiness, and there is a persistent ideas of hopelessness, that I am not. There's no hope. There is a personal idea of worthlessness, that I am not worthy of any good things in life, and helplessness, that nobody can help me. Means मुझे मेरा कोई भी कुछ भला नहीं कर सकता. So this persistent, when they are there for 1 to 2 months, and most of the time they are 24/7. They are not momentary. So it is very consistent and persistent. That is what differentiates between a normal disappointment. And see, normal disappointment and sadness doesn't last for 15 to 20 days or more than 1 month. But when you're depressed, this may last you for 2 to 3 months or 3 to 6 months also. And you can actually see and feel the person that he is not the person that he was. You can see a change in his personality.
So the family can also.
Yes, most of the time the
identify that.
patients don't realize, because when they're going through this phase, they don't realize. And there's a lot of stigma that, don't want to go for mental health evaluation.
Exactly.
Or don't want to see a psychiatrist. I'm not mad. So sometimes the relatives see that, and the relatives are able to convince the patient, ki nahi, I think, or a friend also, ki I think, okay, if you don't want, you think it is not needed, but just go and get yourself evaluated and see what the doctor says. So a lot of time the patient don't come, but they are pushed by relatives or friends, and they come and seek help.
Yeah, so we talk about family, right? So, but sometimes we have noticed that, though family is desperately trying to help this person, but sometimes they do worse than what this person is going through,
yeah.
right? So, what advice would you like to give to family members, and how
Right.
should they react in such situation where somebody at their home has lost the job?
Yeah, absolutely. So, see, in India, what we generally do is we don't understand the emotions of the person, what is happening to him. We try and kind of give him advice. So, somebody who's lost a job, his father or his wife, what advice would you? Okay, apply more, do more, try more, see where you have gone wrong. But actually, that is not the right way. The what is required when somebody loses a job is acceptance. Means to understand his way. Like, how are you coping with this? Are you feeling okay? Is there anything that is bothering you? How can we help you? Are you eating well? Are you sleeping well? These are the questions actually ideally a person should ask. Not how will you get a job again? What are you trying to do to get a new job? Because it is very important to connect with the patient before you correct the person.
That's true.
So, and in generally we have all tendency to advise. We are very, very trained in such a way that even a friend comes to us with a problem, our first thing is to advise and solve the problem. But actually nobody is looking for solution, because solution makes a person feel that you are neglected. You are not trying to hear him out. I am not asking for solution. I am asking for somebody to listen to me, and that is what family should do or friend should do. If somebody is disappointed because of this job loss or for whatever reason, the idea should be to connect with that person. Let him ventilate his emotions. Let him ventilate his true feelings, and then once he's little better in terms of that, and he's coping with the situation well, then you can help him out by giving him some advice on how he can help how he can get himself out of this situation.
Correct. Correct. So this is true. I think yeah, a family definitely needs to help, and we have also seen in most of the cases people feel ashamed after layoff, despite the fact that it was beyond their control. So why, from where this shame come from?
Yeah, so in our society, everybody celebrates success, employment, passing with flying colors. We are not trained or tuned, or we are not trained enough to understand failures or deal with failures. So generally, when a person loses job, he takes it as a personal thing. It is actually a company's decision most of the time, or there are like a lot of factors which are beyond your control when you lose a job. But when you personalize it, when you say that I am not worthy of this job, or I am not good enough, or I am a failure, or I am behind people around me, I am not as good as them, because these job loss is interpreted in this way. So there is a faulty interpretation, unfortunately, because we are trained in that way. Our schools, our systems, our parenting does not teach us to handle failures better. So we are wired in such a way that we personalize everything, but actually most of the things are beyond our control. It is not in our control. So when things are even beyond our control, when we internalize and personalize these issues, they lead to sadness, anxiety, emotions, problem. That's why therapies, what we do for some patients, they require therapy. Why? What we do is we change the thought process, because when you think in a different way, you feel a particular emotion. When you change your thought pattern, the intensity of the emotion goes down. So that's why these problems are very pertinent, and they are very pertinent to today's generation.
So you've saying that you focus on the thought pattern, right? So
Right.
how do you do it? Can you just give us the
Yeah.
idea on that?
Right. So so every problem has a thought, an emotion, and an action. Right. So when we are talking about unemployment, right, or job loss. So when somebody loses a job, so what will be emotion like? He will feel sad and disappointed,
And incapable.
incapable, right? And what is the thought behind it? I'm not good enough. I'm a failure, and I'm not worthy of good things in life. And so what will be your action? Your action will be that you will get depressed, you will get frustrated, you will get anxious, right? Now with the therapy, what we do is we challenge this thought. Like, okay, what are your past rates of success? Then he'll say, I was successful as a kid, I was successful in 2-3 jobs, and now I'm not, I've lost this job. So is your thinking that you are a failure or you are not at all successful, is it correct? he'll say, no, I think I'm exaggerating, right? So when person understands this thought pattern, his emotions become better, and then he is willing to work or solve the problem. Because most of the time we ask why, when you ask why did I lose job, and there's no answer to the why, because why is going to lead to more problems. You are blaming yourself for the situation. But what if we change our why to what can I do to make myself feel better? The job loss has happened, now you don't have job, that is a reality. How can I face this reality better? How can I cope with the situation better? How can I look after myself so I'm prepared for a new job, or I'm prepared to learn a new skill that is required to get a new job, right?
Yes, agree. But instead, what happens? I'll tell you. Like, despite all these things, despite having rejections and all, when the person like they awake morning, they just start scrolling their LinkedIn platform and see that the new job announcements, or somebody is appointed, or somebody is promoted. So all these things they see, and this actually impact their mental health more dangerously than they can think of. So my question to is that do you think that comparison on the professional platform on the such as LinkedIn, right, it has actually triggered the mental health issues more dangerously than one can think of, for especially for the job
Yeah,
seekers?
absolutely. So social media comparison on LinkedIn, it makes you feel disappointed more, because then you are only seeing the success stories, and nobody is seeing the failures behind the success stories. And when you're seeing everything, you feel, okay, all your friends are going ahead in life, everybody is having a fantastic life, I am the only person who doesn't have job. So you feel very disappointed. And something, social media is something which you cannot avoid. Everybody uh, goes and sees LinkedIn profile, for especially for job seekers. So one has to be on a LinkedIn, because
Correct.
then everybody checks your profile there. So you are absolutely right. Social media has fueled this crisis, especially for comparison. And lot of things on social media also which people put, they are not completely correct. So people don't go exactly by what exactly is doing, but they will just read the superficial part of it and say, अरे इसका life तो कितना अच्छा है, हमारा life तो बिल्कुल खराब है इसके सामने. So yes, yeah, you are absolutely right. This.
So how should people deal in such situations? Should they stop scrolling LinkedIn on daily basis, or maybe is there some other way? Because LinkedIn again is important for those job seekers, because definitely they are getting
Yes,
jobs also from there. But
right.
how do they deal in this kind of situation?
So see, one has to understand that what is there on social media, everything is not, everything is glorified, glamorized, and you can't just completely cut off from social media. It's a part of life right now, and it's
Correct.
something which you need to be on. For suppose if you're a professional, you need to be on LinkedIn. You need to search for opportunities there. I would suggest that one has to be little more rational in terms of when they see somebody else's success. You need to also celebrate your own success. I'm sure everybody has moments of success. So some people put it on social media or LinkedIn. Some people don't put it. So it's very important to realize that everybody has successful stories to share. It is just that some people share more glamorizing it. Some people don't. Also, everybody has their own journey, right? There are some people who become millionaires in 25, some people who get millionaires in 40. Some people are not millionaires, but if you say consider quality of life, it's a very good quality of life. They have a healthy balance of family, sports, and work. So comparing only one aspect, like somebody got a funding of 100 crores, or somebody became a CEO at 25 years of age, or some doctor has won Padma Bhushan in a very young age, that is, yes, of course, it's a success story, but there are many aspects of success. So we should take everything, we should rationalize it. We should not get disappointed by it. And the way to look at these kind of LinkedIn or posts is to be more rational about it, to understand your own journey, understand your own weaknesses and strengths. And uh, everybody has their different journey. So I think one has to be a little more rational about it.
Understood. So let's say now we are talking about, we discussed a lot about this. Now let's zoom out a bit and understand the organization, right? Because they are the one who created this vacuum for the person, and definitely we need to think from that perspective as well. So, how, according to you, organizations can actually handle this layoffs in a more human and psychologically safe way? Do you have
Yeah.
any?
So I think even organizations are finding it very challenging. Now, see, there is an organization, what I know, they were employing 100 people for the job that they were doing, right? But because of the AI, they need only 20 people for that job. And why would not a company do it? Because every
Exactly.
company
That's
has its own right. How much ever they are humane, they are very very empathetic towards their employees. But there is some reality which even they don't
yes.
know how to
Everyone
deal
has
with
to
it,
think of
right?
P&L at the
Yeah.
end, right?
So what is happening here is that even the companies are not really prepared on how to handle this, kind of when they tell the employees to go, how to deal with it. But I think two three policies that they can do is always give respect to the employees, don't disrespect them, understand their value to the organization, also give them a little bit of timeline where they can mentally get prepared for it, and develop a culture where even like you celebrate success but you also celebrate unemployment, or
That is very, very good point that you said, right? In our society, we actually celebrate only success. Something should happen that people start celebrating failure. I think from that day onwards, this mental health issues, they will reduce drastically.
Absolutely. So, one what is important is to understand that as a society, we are not understanding human emotions that well. We don't understand what if somebody is told to go just next day, and if somebody who's being, if you prepare that person, don't know we are having this policy in our company where we are going to, get 20 people this, and you may be one of them, so we don't know, but at least you are informing that person that he may be one of the person who may have to look out for another job. So even that bad news always given in, kind of you can say small parts is always accepted better than you just say, okay, from tomorrow, you just
Yes,
there are-
that's true.
yeah. So
How this is communicated, that makes the
absolutely,
difference.
absolutely, yeah.
Correct. So, see, there are some of the organizations who are definitely following this way, and they are really doing good in this today case. But there are few which are still evolving, right? So, the person who has lost the job is sitting at home. He cannot wait for the organizations to evolve, right? He has to take actions on his own.
Right.
So, how he can do? What are those three non-negotiable traits that a person should start adapting to maintain, to stay confident and resilient?
Right, absolutely. So I think for all those who are watching this podcast, and if you're sitting at home because of the job loss, I completely agree what you're going through, and it's not easy. It's a difficult time, but please make sure that you do 2 to 3 things in your daily routine that keeps you going, that keeps you upbeat. Your sleep and appetite is non-negotiable. Exercise is non-negotiable. Connection with your family members and friends is non-negotiable. These 2 3 things are something: exercise, nutrition, sleep, connecting with your peer groups is something which will keep you going in this tough time. Also, celebrate small victories. I'm sure you have to understand that, this is one chapter in your story, it is not the entire story. So one chapter in a story doesn't define a story. Everybody, I have gone through so many people who have had job loss, who have had failures in their life, and that time you feel this is the worst moment of my life, but it is not true. This moment shall pass too. You just have to stay up a beat, keep doing the normal routine things, celebrate small victories. And yes, if you need to learn a new skill, or you need to think that you need to apply through this channel, you must keep going. Don't lose hope. Of course, there are a lot of challenges in the job market at this current time, but there are all challenges lead to opportunities also. So just keep yourself going and don't lose hope.
Thank you so much. So, can you share one story with all of us that where you helped a person and then he really did wonderful in later years of his life.
Right. So, yeah, I mean, there are many stories like that. One particular story I would like to say is that, I had a corporate employee. He was in a very good position. And suddenly, because of some changes in the industry, he lost his job.
Okay.
And that was the first failure he had ever experienced in his life. So he became very depressed and he did not know what to do. And for 1 to 2 months, he was lying on the bed, not applying for anything, not sleeping well, not eating well. The wife noticed these changes, and wife knew me through a friend because she had seen one of her relatives also going through the same situation.
Right.
So she kind of pushed him, since he was a very well read, very good person, and he was not willing to accept that he is going through this depression or some kind of anxiety because of these issues. So he was very reluctant to come, but somehow she managed to bring him, and I spoke to him. And he said, "Doctor, I don't know what is happening, but I don't think I can get better by your treatment or by some kind of medicines or counseling. I don't know how will I come out of this situation." I said, "Fine, what I would suggest that if you don't find a way out, just try something, take something, at least improve your sleep and appetite and get out of this situation first, and let's see what happens." So then he reluctantly started the treatment. He started feeling better. So at one point he was not applying for jobs, or he's not was not doing anything to kind of get back into industry, and he was feeling very negative about everything around the industry and the environment. But then he kept on going. Then by something he was getting a job, but it was not a position that he was used to it.
Correct.
So he asked me, "Doctor, I don't think that is the right position for me right now. I have been worked in a better position." I said, "Do you see a job coming to you in another 3 to 6 months?" He said, "I don't think so." I said, "Then just go for it and take it, right? Because better to start a job than to sit at home." And with the treatment, he started feeling little better also. So then actually he took up a position which was lower than what the position he was.
Okay.
But sometimes you need to do these adjustments.
Right. You never know what is going to
Yes.
happen next.
And he took up that, and now he's the CEO of the company. So these stories happen. In 15 to 20 years, he just went up and up and up, and that is what the current state is. And he always comes and, "Doctor, thank you, I was not going to take treatment, but now he doesn't need treatment. He's out of it, the whole situation."
So what kind of treatment you give? Is it you consult, you speak to that person and do a consultancy, or
Yeah.
you are giving some medicines? How?
Yeah, depends on the problem that the patient comes with me. So see, most of the patient, when they come to us, they are ideally clinically depressed or anxious. So they are beyond only talking and therapy. If they come very early, when the problem is very mild with some small issues, we can handle them without medicine. But most of these patients require some medicine for some time. So I always tell them that if you have a fracture, you can't do physiotherapy. You need to plaster the bone, right? So if you have a fracture of depression or anxiety because of whatever event in your life, we are discussing job loss as an event here. So that requires the rational approach of just talking, just feeling upbeat, or just exercising may not help, because they are not sleeping well, they are not eating well, they are getting constant negative thoughts. They don't see hope around, they don't apply for jobs also. So they need, and people feel that these are all because they've got negative. See, nobody wants to become negative. There is a chemical in the brain, there are chemicals in the brain like serotonin, norepinephrine, dopamine. When they go low, the reason can be sometimes biological without any reason, but many times, like if you as a job loss or a breakup or some emotional trauma, whatever, they cause these chemicals to go low, and then they start feeling low, depressed, anxious, and that time they need a short course of treatment. Most of these treatment lasts for 3 to 6 months. Some patients need to take treatment for long. So when they start treatment, they start getting hope, they start feeling better, they start eating better, sleeping better, they start applying better, they start giving their interview better. So the mindset becomes positive.
So should I say that those medicines, they are actually impacting that chemical which
Absolutely,
has reduced?
absolutely. The name also suggests. So most of the common drugs that are given for depression and anxiety are SSRI or SNRI. Now, what is SSRI? It is selective serotonin reuptake inhibitor. What does it do? It improves serotonin in the brain. So something like SNRI, selective serotonin and norepinephrine reuptake inhibitor. And there are certain medicines which improve dopamine also. So yes, they work on the neurotransmitters of the brain.
So this dopamine, I know only this terminology.
Yeah,
I've
dopamine
heard
is
a
very
lot.
famous.
And, is it very important? I mean, it is one of the important chemical that should release
Absolutely.
to keep you motivated.
Absolutely. So dopamine is talked about lot in nowadays because everybody wants dopamine rush. So like when you eat a cake, you feel very happy because there's a dopamine rush. When you celebrate or when you become successful and you pass your exam with flying colors, you get that dopamine rush. So dopamine is very important because dopamine gives you that pleasure of performance, pleasure of success. So dopamine is a pleasure chemical. Now in depression, the dopamine goes down. So even when you eat good food or when you sleep better or when your child becomes successful, you don't feel that happiness because the dopamine is not there. And that is why you feel that it's called anhedonia, means loss of pleasure in pleasurable activities. So and when that is not there, you don't have that motivation because see, everybody wants pleasure in life, pleasure of earning more, pleasure of enjoying vacation, pleasure of working, pleasure of doing things. When the pleasure is not there, there's no motivation. So dopamine is very important. And in fact, lot of patients say, what is the natural way to increase this neurotransmitter? The best way to is physical exercise. It is the most underrated activity that one person can do. Now physical exercise, when you say, ideally it should be like 30 minutes of brisk walk or going on a treadmill on a gym, or playing some sports like tennis or badminton where you sweat a little, because that will keep your dopamine and serotonin reuptake in control. Like when you do little rigorous exercise, normal than just normal walking, more than that, that will keep you, these dopamine and serotonin is secreted naturally. So in fact, people who exercise daily handle tough situations like job loss better than people who don't exercise.
Okay. And the reason is that dopamine gets released, which is very important
Yeah.
for us to maintain our mental health.
So their dopamine levels are better than the person who don't exercise.
So is there something, some equipment that tests the dopamine level and all? Is there?
Unfortunately, there is no blood test because these dopamines are dopamine, serotonin, norepinephrine are they are brain chemicals. So you will have to put some syringe in the brain and remove some fluid and all, but still you cannot measure it. Most of these are done in experiments, right? But because up till now we can't measure this chemical so better.
Okay.
But we know for the fact that when we give some medicine which improves the serotonin, norepinephrine, dopamine, or when we do some physical exercise which improves this, there is a definite improvement in the mood. So we can't measure it yet now, but maybe in future we'll be able to measure it better.
Okay. Very interesting. I mean,
Yeah.
very interesting facts you've told. I think I can practice this daily because, I also do exercise, but this rigorous exercise is the
It's
way
very
you
important,
can
yeah.
release the dopamine. And
Yes.
it has a lot of impact. That
Yes.
I got to know today. Thank you so much, doctor. So let's say if somebody who's listening today, okay, and he is completely exhausted, he lost the confidence, everything, like he is feeling very low in his entire journey, right? So what message would you like to pass on to that person?
Right. So if you're feeling very disappointed and depressed, first and foremost, you're not alone in this. Talk to your friend or somebody whom you trust about your situation. Don't sulk and don't lose hope. If you feel that there is nobody to talk to and I cannot talk with this to anybody, please see a psychiatrist or a therapist whom you can ventilate your emotions. And if that person says that you are clinically depressed or clinically anxious, be open to idea of taking medicines to get out of this problem. Because the early you get out of this problem, the more chances you have to kind of recover completely. Also, don't lose hope because hope is something that you should always keep in your mind, and if you work towards it, definitely you will find success. This is a transition, this is a temporary moment, and if you need any help, please go and see a doctor. and I'm sure the doctor will be able to help you. Thank you.
Thank you. I would say all my listeners to please digest this now, okay, and just carefully understand what doctor has mentioned, and also please note that you are you are not you are basically more than your job, more than your salary, and more than your LinkedIn profile, and also much more than what your organization has thought of you once. So I would say thank you so much, Dr. Mohit, for joining us on today's platform and letting us know about all these things. Very insightful for us to understand about this, how this mental health is impacting us. Till that time, I request all my listeners to please take care of your health, because that's the most important asset that you have, and that is where you all should focus about. Thank you so much. Thank you, everyone.
Thank you.